The physical examination may improve detection of a difficult airway. It should be conducted prior to all anesthetic care. By assessing multiple features, the prediction of a difficult airway increases. What are the components of the airway physical exam? Are the upper incisors longer compared to the rest of the patient's dentition? If they are, this is a non-reassuring sign, and the incidence of dental injuries increases. How is the maxillary and mandibular incisor relation with the patient's jaw closed? Does the patient have a prominent overbite? An overbite would be a non-reassuring sign. Can the patient bring their mandibular incisors anterior to his or her maxillary incisors? If they cannot, this indicates a limited range of mandible motion or a short mandible. What is the interincisor distance? As another measure of mandibular range of motion, a distance less than 3 centimeters is worrisome. Can the uvula be visualized? Proper inspection of the uvula requires the patient to be in a sitting position with the tongue protruding and no vocalization. Is the patient's palate highly arched or very narrow? Such a palate will limit the laryngoscopist's field of view and oral access. How stiff is the mandibular space? Is it occupied by a mass? Non-compliance of the mandibular space can potentially make ventilation and intubation difficult. The remainder of the airway examination is focused on the external evaluation of the patient's neck. How long is the thyromental distance? A distance less than 6 centimeters is associated with a short mandible and represents another non-reassuring sign. This distance should be evaluated with the head in maximum extension. How long and thick is the patient's neck? A short, thick neck will limit the laryngoscopist's ability to extend the head and properly manipulate the patient's airway. What is the range of motion of the patient's head and neck? A limited range of motion will limit the manipulation options available to the laryngoscopist. The range of motion should be evaluated by having the patient attempt to touch the tip of their chin to their chest and to extend their neck.